The federal government accuses several doctors in our License to Pill series of accepting kickbacks in return for prescribing a dangerous drug. According to a civil case recently unsealed, those providers fraudulently billed taxpayers nearly $70 million. Here's License to Pill. Patients clinging to life.
You're lucky to be alive.
Amen. Absolutely.
Near-death experiences, the product of greed.
What if my kids would have lost me because of him trying to pad his pockets?
The doctors who improperly prescribed a cancer drug called Subsys to Tamison Witherspoon and Dina Demarest have been charged, but other doctors Raycom Media has investigated over the past 6 months remain licensed. We found many of these doctors took money from the cancer drug's maker, Insys Therapeutics, to help promote Subsys. At the same time, many of those same doctors steadily increased the amount of Subsys they prescribed.
The problem is that you have profiteers that are working within this specific realm, i.e. doctors, pharmacies, and the pharmaceutical company, who are taking advantage of the system.
Randy Hood represents several patients suing some of those doctors. Our investigation found 85% of all doctors who received at least $50,000 from Insys still have an active medical license.
That's scary.
A recently unsealed federal lawsuit details the depth of the alleged fraud. In February, we told you about Florida anesthesiologist Bart Gatz. He took $230,000 of Insys money for consulting and meals. Since 2012, his Subsys prescriptions cost Medicare $3.3 million. The complaint alleges in 2013, 2 Insys executives took Gatz to an Arizona strip club. Days later, Gatz sent a text message to one executive writing, "Thank you for the best weekend in years." The U.S. government joined 5 former Insys employees in accusing Gatz and 19 other medical professionals of accepting payments from the company and billing the government about $70 million. As of late June, 11 doctors named in the lawsuit, including Gatz, have not been charged with a crime.
There's a wealth of data showing that doctors who receive payments from drug companies for promotional speaking are significantly more likely to be heavy users of those companies' products and services.
Which is legal, as long as the payments don't entice doctors to write more prescriptions. Dr. Eric Campbell says about 85% of the doctors in the U.S. accept payments from drug companies. He says eliminating those payments may help reduce the near-death experiences patients like Tamison Witherspoon and Dina Demarest faced.
These payments many times are simply nothing more than a sham for a kind of kickback that doctors receive. And that's problematic because in that case, the doctor's financial interest may have superseded his or her primary concern, which is for the health and welfare of their patients.
Insys ended its speaker program for Subsys earlier this year. The company did not return our calls for comment.